Hey guys, we're back. We're at the lake today, Lakeside Chat, really at the lake.
A real lake, yeah.
Yes, a real lake. We're kind of doing another cat talk in our cat series, and we're going to talk about feline infectious peritonitis.
FIP.
FIP.
So, I get my questions here. Got the answers, I just don't have the questions. What exactly is FIP besides feline infectious peritonitis? And how does it develop from feline coronavirus?
Yeah, so like FIP is basically a coronavirus, a really common coronavirus that attacks cats. It usually causes minor diarrhea, sometimes upper respiratory signs, and they kind of get over it. In 1 out of 10 cats, this particular virus mutates and becomes really nasty, and it infects the cat's white blood cells and spreads throughout the entire cat and causes a tremendous immune response in its host.
So how common is FIP in cats?
FIP in cats, it's not super common. So a cat that gets infected with a coronavirus, like 10% of them will go on to develop FIP. Most cats that are infected with it are usually under 1.5 years.
Okay. Are some cats more susceptible to FIP than others, besides just the younger cats?
Yeah, younger cats, sometimes really, really aged cats, probably due to immune system, compromise. Cats that come from high stocking density, like shelters, sometimes catteries. And then purebred cats, whether it's their genetics, because there may be a genetic predisposition for this. Also, a lot of purebred cats come from catteries, which are high stocking density. So I don't think they know, research is still being done and coming out there, but there may be genetic predispositions for some of these cats.
Okay. Is it contagious to other cats or animals?
Once it becomes FIP, no. It's an individual mutation that does not spread. It's not shed at that point. Feline coronavirus is quite contagious, but overall, feline coronavirus is a pretty mild thing. It's the mutation. And once it's mutated and they become FIP, it's not infectious to other cats.
Can FIP spread to humans?
No, it is not a human thing at all. It is an individual mutation in a cat. So.
Okay. How is FIP diagnosed?
Unfortunately, there's not a great test for FIP even now. So a lot of times it's the severe immune response that we're seeing, and they're not shedding virus, so there just aren't a lot of great tests. So sometimes it's based on age, signalment, symptoms. Sometimes, the wet form, you can get fluid in the abdomen, you can test that and look for certain proteins and things like that. There are some other advanced tests that sometimes aren't super accurate. So, it's still right now a disease basically diagnosed by ruling everything else out and then just doing an empirical treatment.
So can it be confused with other illnesses?
It can. Things like toxoplasmosis, lymphoma, can mimic like the dry form where you get chronic kind of wasting and neurologic symptoms and things like that. There again, you try to rule those things out, and then we're like, well, we don't feel like these things are going on, so let's try treating for FIP. Yeah.
I hope this microphone doesn't pick up my stomach growling.
You can edit.
What are the different? That's a cat sound. Yeah. You kind of touched on this, the differences between the wet, or they call it effusive, and dry, the non-effusive.
Right. So the effusive is basically this virus causes tremendous inflammation in the vascular system, and the vessels become leaky and they start leaking fluid out into their body cavities. The dry form is these basically nodules or foci of inflammatory cells and things like that disrupt brain tissue and kidneys, things like that.
Sounds very serious.
Yeah. This used to be a pretty much a death sentence when a cat got it. So.
Well, I had one that had FIP, a little kitty that came to our house, and it was sad because she was really sweet. What symptoms should I watch for that might suggest my cat could have FIP? Yeah,
so you're basically gonna, if it's a young kitten, you wanna look for fluid in the abdomen is kind of like the big wet form. But basically fever, weight loss, sometimes anemia, just kind of a bunch of general signs.
Just not good.
Yeah, basically a sick cat. Yeah.
As a ADR ain't doing right.
Yep.
So why is it so difficult to confirm a diagnosis? Because there's no specific test for it, correct?
Yeah, right. And like I said, they're not shedding virus that you can like pick up and test. You can sometimes they can find it in the fluids and things like that and test. And unfortunately, histopathology on postmortem. Yeah.
Doesn't help much, does it?
No.
Is there a cure for FIP now?
Yeah, so there's a treatment that's different from cure. It's an antiviral agent that is not FDA approved. But the FDA is allowing us to prescribe it if we feel it's necessary, and it has to be compounded at a special pharmacy. There's only 2 in the United States that are able to compound it, that are going to compound it appropriately.
Is it just for cats, so they have to know?
Yes, yeah.
Exactly.
They may have something similar off the human side, but this is for cats. So it basically prescription. It's not dispensed in all clinics because, first of all, it's a niche product, and second of all, some states don't allow. It depends on the state you live in as far as dispensing compounded items like that. So,
do we allow it here in North Carolina?
I believe so. Yeah, I believe so. I want to say Tennessee might be one of them that doesn't. There's like 5 or 6 of them where you can't stock it. So, so that means you have to have it compounded and shipped. So.
Oh, okay. But you can still use it if you can get it compounded somewhere.
That's right.
So what are the success rates of that?
80% of them will cure. Yeah.
That's really pretty good. So it is a cure then?
It can be, not all of them. Not all of them. Some of them relapse. So, they either relapse or they don't respond. So not necessarily.
So how is the medication administered? Do we do it, or does
the owners can do it. It comes in an injection, and it comes in an oral. The oral, there may be questionable bioavailability, especially if the cat's sick. Trying to get oral medication into a sick cat is a challenge on a good day.
Try to get medication in a good cat or a cat.
The injections are typically what's done. The owners are shown how to do it. The injections are kind of painful. The treatments over the course of 12 weeks. Cats, if they're going to respond, typically start feeling better within several days, and by 8 weeks out, a lot of times they're gaining weight and kind of back to what they were, and then typically the treatment's pushed out to like 12 weeks, and then treatment is stopped, and then just monitoring, depending on how severe the cat was to begin with, you pick some monitoring, looking at protein, weight, things like that.
Has this been fairly new that this has come out, since it's not FDA approved?
Right. No, it's been around for a little bit, but it was made in China, I believe, so you had to get it like through these Facebook groups or something. You had to get it like through these weird avenues because it wasn't in this country, and now it's allowed to be produced in this country. So, and then there's all these sites that maybe product purity, or what is it exactly in the product they're trying to sell you? Is it going to be enough of the active drug? Is it full of contaminants? So there's that pitfall with getting it from other sources.
So the compounding pharmacy is the way to go.
Yeah,
because they know their sources.
Yeah, Stokes is.
Are there any side effects or other risks besides getting a bum batch of
No,
cure?
yeah, besides getting product that isn't great product. Overall, cats tolerate it really well. Side effects, I think vomiting, diarrhea has been reported. And then, of course, injection site pain and reactions and things like that. But typically, it's really well tolerated by cats, though.
Is it fairly expensive?
It depends on kind of how long you have to use it. If you have extended courses, some of the if you have to raise the dose because the cat needs a higher dose because it's not responding. Kitties with neurologic disease typically are going to be the ones that don't do as well. So sometimes you have to use higher doses. So it depends. It can be, yes. And And then I think the biggest cost is A, the diagnosis, and B, monitoring. You know, like just like everything, it's not just I order this drug and we're done. There's a package of monitoring and things like that you kind of should do with it. So
you can provide treatment as a veterinarian, or do you have to send them to a specialist?
No, you can provide treatment as a veterinarian. The specialists might be able to stock it. So, and the problem is with some of these kitties is they're so sick that they need 24-hour critical care support, basically to keep you alive until you get the medication. So that's where a lot of times specialty is going to come into to play, because they're going to be able to do your blood transfusions, all of that, because a lot of these cats are, you know, they need a lot of stuff like that until the drug can get there. And then some specialty practices, I know like Cornell in New York is stocking it, but I'm not sure around here. Thank goodness it's not super common, but yeah, you know, that you might, specialty window may actually have it to give it to your cat right away, whereas we're going to have time to have it made, shipped, all that kind of stuff.
Right, that can be a little prohibitive.
Yeah.
So the prognosis, you said, is actually pretty good,
yeah,
80%?
It's actually pretty good if you know, basically, and a lot of times initially it depends on how sick are they. You know, if you have a red cell count that's barely registerable, you know, your prognosis is poor for survival. If you have disease in the central nervous system, seizuring, things like that, those cats don't do as well because the drug can't get there.
Oh, okay.
Yeah. So
how do you know that treatment is working? Like you said, they start to gain weight,
they
and
start
they start
to eat,
eating,
feeling better. It's exactly.
So it's fairly obvious then.
Yeah, they have fever-free. You know, their fever goes away. They're eating. They're gaining weight. You weigh these cats weekly to make sure they're gaining and feeling better. You can monitor. You know, if they were anemic, their red cell count. You can monitor their proteins, because their proteins typically are sky high from the globulins or antibodies. So you can watch that kind of drop. So, you know, basically, and just watch for, basically, if the cat was doing well and suddenly it's not, you know, maybe it's having a relapse during the treatment and needs a higher dose.
So that can happen at any time, but you have the option to raise the dose and see if they respond that way.
But overall, they feel like 80%, you know, do really well with it if you can keep them supported.
Okay. So they can be completely cured, but there's always a chance of a relapse, or is there?
They're always,
but you don't know until they don't have a relapse then, right?
You don't know.
Okay. And you kind of went over the monitoring and follow-up that needs to be done to
and that's for the individual, suited to the individual. Cats get a varying presentation of severity, you know, kind of thing, so.
So can it be prevented, and how do you prevent it?
Well, there's no vaccine for it. So prevention is good litter box hygiene. You want to keep diarrhea viruses to a minimum. Basically, you want to keep 3 or less cats probably to a litter pan or room. You want to keep your stocking density low, you know, that sort of thing. If you're getting a cat from a shelter or something like that, maybe quarantine that cat for a couple of weeks. Most coronaviruses take like 7 to 10 days to kind of break, you know, and then that cat's not going to flood coronavirus into the environment for the other cats in the house, those sorts of things. So it's just kind of, you know, not having 20 cats in a single room, and, you know, kind of something I think it would be a legitimate question if you're getting cats from a cattery, you know, like, has this something you've encountered in the past, you know, that sort of thing, just to see, you know, is there, you know, have they had some past cats that have developed FIP? You know, that might be something you need to think about. I don't know. But
right. Our little cat just came from
shelter.
No, just you know, our cats, they kind of drop from the sky and just show up at the house. And, and so she was not completely well, but she, you know, she never gave it to the others, luckily.
Yeah,
so we were very lucky on that.
You know, healthy cats, just keeping your cats healthy, you know, making sure that they go to the vet and kind of have their blood work and things like that. Just doing the best to keep a cat healthy and not debilitated in any fashion, you know, offers them some immune resistance as well.
That's good.
And I find, like, stray cats, sometimes they come from a colony, you know, that, you know, so, you know, that might be part of that kind of scenario as well.
So how long does the virus actually live in the environment, do you know?
Oh, it's very easily. It needs a host, so it's easily disinfected with just. It's a virus that has a capsule, so regular cleaning. It's not like parvovirus, which sits around forever. It dies out pretty quickly. Yeah.
So, and you already said that cats in your house aren't normally going to get it if you give good hygiene and keep them separated for a little while until you're sure that one feels good.
Yeah,
but there's nothing you can do to treat them preventively.
No.
There's no vaccine.
Nope, no vaccine.
And is it safe to adopt another cat after losing one to FIP?
Yeah, like I said, right, keep everything clean your bowls, all of that kind of stuff. But once the cat has FIP, it's not going to give that mutation to another cat. They don't typically shed it. So that's really, I don't know that that's been heard of. So
I guess that's one reason it's not as common, which is good.
Yeah, that's right. It seems to be an individual cat thing. So as long as you kind of cleaned all the bowls, I might, if there was a cat bed that kind of had stuff on it, from just coronavirus where it could live, I might get rid of that or wash it. But no, overall, I think it's safe.
Okay.
Well, if you have any questions about FIP, luckily it's not super common in our setting. We look for it and really don't see it a whole lot. So, let us know. And then we'll be happy to take a look at your cats to keep them healthy.
There you go. Thank you very much.
Yeah.